Thank you guys so much for joining us for a topic that is unfortunately not new, but is necessarily back this fall here in Virginia. We will spend a couple minutes at the beginning going over what's happening at the federal level, because there is some activity there. We know less about the federal directive than we do the state directive. And we also, if you are in a different state than Virginia, let us know and we can do a little research about that state. But as far as I know, Virginia is either the first or only a member of a small group of states that have put together ETSs at this point. But of course, as you know, things change rapidly during this pandemic. So we will try and help you out if you're in a different state, if we can. All right, so we have a full house today. We've got the full webinar team with us. We've got Kevin Wilson, Tracy Clark, and Angie Trapp, and my name is Lesley Bruno, and we're excited to have everybody here for our special Friday edition of HR Matters. Welcome, everybody.
Good to be back with you, Lesley.
Nice to see everybody.
Yes, it is.
All right, so we are going to just roll through this deck today. We have about 25 slides. Please put your questions in the Q&A section of your screen there and avoid the chat. Although I will call out that I've already posted in the chat 2 links. One link is to the full text of the Virginia amended standard. It is a page turner. You're going to want to spend all weekend reading it. I say that only half in jest because I have not, whereas I've put a lot of content into this webinar, it's still not the full ETS. And so if you're operating in Virginia, I'd recommend, if you can, going through the document at some point. A lot of it is the same as before, but some of it is new. So you'll want to familiarize yourself with that, particularly if you are in a healthcare setting or in what's called a higher risk environment. There are some specifics in there that I did not go into in terms of those 2 categories. So I would definitely check out those sections if you are in those categories. All right, and then we are recording this webinar and we'll put it on our website by the end of today. It's the COVID-19 resource page, which you can find by clicking on the bar at the top of our homepage at dominionpayroll.com. And if you don't feel like submitting questions in this format, you're welcome to submit questions after the fact to questions@dominionpayroll.com, and that'll route to this team and we'll answer those the best we can.
Hey, Lesley.
Yeah.
So Zoom does this fairly annoying thing where if you put something in the chat before we invite folks in, it's not visible to folks who haven't already joined. So if you're able, could you drop that link in the chat one more time?
I'm probably not able because I'm too afraid to navigate away.
Yeah, I hear you.
But how about that?
I will dig around and I'll get a link and drop it in the chat to the full text, and
okay,
so everybody can have that.
Great, thank you. And I also attempted to put a link to the Virginia Department of Health's case reporting portal, which is a little bit harder to find, but if you can't find it, that's fine. Olivia's gonna put these links on our COVID page after the webinar today. So thank you, Kevin. And thank you, Allison, for letting us know. All right, let's dive in. So we are here to talk about the Virginia today, but also what is happening at the federal level. As you guys might have heard, a couple weeks ago, Biden announced a COVID-19 action plan, which is a multi-point plan, but one of the largest ones is he included a directive to OSHA to develop a vaccine or test ETS. That's emergency temporary standard. We are still awaiting exact language and rules, but it will pertain to approximately 80 million workers. And again, this is private employers as well as, public employers have some different rules, but this is for private employers, nonprofits, et cetera, with 100 or more employees. The choice here is either to ensure that their workforce is fully vaccinated, or to require any workers who remain unvaccinated to produce a negative COVID-19 test result on at least a weekly basis before coming to work. This would also require employers with more than 100 employees to provide paid time off for the time it takes for workers to get vaccinated or to recover if they are under the weather post-vaccination. It's my understanding that the guidance that will come out will indicate that the 100 employee threshold is based on your total number of employees rather than on the number of employees at a particular site. And also we expect the language to address whether or not employers must pay for testing, although the word on the street is that the employers will be asked to pay for testing for those unvaccinated employees. I was hoping to see some new information today. I know it's still early today, so maybe we'll see something later with more guidance. But I also have heard that October 15th is another date that we should look out for in terms of guidance for this particular directive of the action plan. So sometime in the next several weeks, we'll know more. Obviously, there's a lot to unpack here. As you might imagine, this is being contested. The attorneys general from 24 states have sent a letter to President Biden questioning the constitutionality of this directive. And as far as I know, as of yesterday, at least, Arizona was the only state that has actually filed suit. So we're not sure what's going to happen with that. There's a lot there. If you want to dig deep into that, there's a whole lot of different opinions about this directive, whether or not OSHA has the authority to regulate this type of requirement, et cetera. So we'll see what happens. Now, for federal workers, the executive order here is that they must be vaccinated, and the testing option has been removed. So that's a new development as well. And we do know that they have about 75 days to get fully vaccinated from the time the executive order was signed. Of course, there will be exemptions for individuals with bona fide disabilities or religious beliefs. Excuse me, but I will say that exemptions they're not 100% guaranteed. So basically, if someone's saying, I would like to not get the vaccine because I have a disability or a bona fide religious belief, they're requesting what's called an accommodation in the eyes of the Americans with Disabilities Act. But that accommodation can be denied by the employer if you can determine and prove that it would prove to be an undue hardship on you and or a significant risk of substantial harm to the health or safety of your employees, that employee, the employee's coworkers, customers, or others that cannot be eliminated. Oh, excuse me. So that's some fancy language to say basically evaluate on a case-by-case basis if approving this accommodation would pose a risk to your business or to your team. Common exemption or common accommodations for employers that can work from home or can have a work from home workforce is that teleworking option. But if that's not an option, then you have to really evaluate whether or not an unvaccinated employee will pose a threat to your team.
So Lesley, quick question for you.
Yeah.
I've sort of seen in probably just flippant like Facebook comments and things like that, but people saying, well, I'll just say it's against my religion. How viable is that in terms of somebody who's just like, oh, well, I'll get out of this just by sort of quickly saying, oh no, I have a religious exemption?
That's a great question. The religious one is really tricky because, and I've been evaluating for one of my clients, their exemption requests, and a lot of them are on religious grounds. And fortunately for this client, a lot of these folks can work from home. So that sort of takes a little bit of the edge off of it. It's tricky because as opposed to the disability reason, the disability requests for exemption would require verification by a physician. So that's really straightforward. But the religious one is tricky. If you think that you're going to be getting a lot of requests for accommodations for religious reasons, if you don't already have an employment attorney, I would go ahead and find one. Or if you have an HR professional on staff, or if you don't, try to reach out and find somebody to help you evaluate those. Because it's not as simple as saying, oh, here's a list of the religions that are opposed to vaccines. It's not that cut and dry. I thought it was going to be that cut and dry, but it's not. I mean, some of these religious exemption requests, I've seen people just copy and paste Bible passages, and that's the request. And
Wow.
so but also at the same time, who am I to say that it's not a bona fide religious belief? So I think you need to evaluate them based, like the request based on that employee's specific role. Can they work from home? Great, that makes it easier. If they can't, evaluate if you can keep them away from other teammates, keep them away from customers. What sort of, when the rubber meets the road, when this person is working and they're unvaccinated, what does that look like? Because again, you do have an out as an employer if it creates an undue hardship. So I would not focus so much on the religion itself and not sort of go down that theological rabbit hole of which religions oppose vaccines or not, because you're not going to find answers, or at least clear answers. I would focus more on the role of the person and how them being unvaccinated affects your business and your team. Does that
Thanks
answer
for
your
that.
question?
Yeah. No, that was that was clarifying for something that feels really complicated. So thank you.
Yeah, I mean, you just don't want to be accused of discriminating, but at the same time, you've got this, the ADA does not make it 100% foolproof for these religious exemptions. Okay, so that was a real quick discussion about the federal outlook. So we will certainly have more on that as it comes in. We're going to go to Virginia now, but of course, if you have questions about the federal directive, please let us know. Okay, so Virginia now has a newly amended emergency standard. It was issued on the 9th. It's effective on October 8th. And there is a training deadline for employers in the healthcare industry and also those who are considered higher risk. And that training deadline is November 7th. It is issued and enforced by the Virginia Occupational Safety and Health Program, or VOSH, as well as the Virginia Department of Labor and Industry. Now, by way of a little bit of background, so in June 2020, Virginia issued an emergency regulations that divided workplaces into categories of low, medium, high, or very high risk, and laid out regulations for masking, sanitizing, screening, social distancing, quarantining, and returning to work post-infection or exposure. You might remember this all went down last summer, and the deadline to comply was in September of 2020. We helped a lot of people. We did a bunch of webinars on it, and we helped a lot of clients sort of unpack this and assess whether they were low, medium, high, or very high risk. And then they had to write a plan and kind of do training. And that was a big deal for employers in Virginia. And as far as I know, if it was the only one in the country, it was maybe just part of a few states that went this far. And anyway, compliance was tricky, but most people were able to make it work. In January, those initial emergency regulations were reissued as a permanent standard. But at the time, vaccines were just rolling out. And so the standard did not distinguish between employer obligations to fully vaccinated versus unvaccinated employees. In May, as you might recall, May is when the CDC said, hey, you know what, if you're vaccinated, you don't have to wear masks anymore. So true to form, the state of emergency executive order here in Virginia and most of our mask mandates were suspended. The Department of Labor regulations in Virginia faded from our memory as vaccination rates rose and infections rates dropped. Northam directed the Department of Labor to align the Virginia standard with current CDC guidance, which at the time was going towards, was saying no masks for vaccinated people. Then fast forward to August, after the Delta variant came in and squashed all of our hopes and dreams for a maskless fall, the Virginia Safety and Health Codes Board and Governor Northam approved an amended standard, which no longer requires workplaces to assess their risk level as high or very high, high, medium, or low. And now, thankfully, has one set of rules applicable to all workplaces. But like I mentioned earlier, there are some additionally expanded rules for healthcare facilities and other higher risk workplaces. So I would, if you think you fall into one of these categories, I would suggest that you look at that section of the ETS that Kevin has linked in the chat, because I do not go into all the specifics on this webinar. And then here in this month, the amended Virginia standard was announced and made public. The big takeaway here is one of the big takeaways is that if you as an employer follow all the current CDC guidance, whether it's mandatory or not, you will be considered as acting in compliance with the Virginia standard. So if you don't feel like reading the 55-page document that's linked in the chat, and you just want to go to your bookmarked CDC guidance page, if you follow all of that, you are fine with the Virginia Safety and Health Codes Board and VOSH and Dolly. So that's a little bit of background. I had to go back and sort of research and remind myself how we got here. So essentially we had an ETS last year. This is now an updated version of it, and it goes into effect in a couple weeks. Okay, some key requirements of this amended standard. So this is the same as before. Much of this is the same as in 2020. It's just, if you're like me, you have either honestly forgotten what it said or just pushed it out of your mind because you were hoping we wouldn't have to do this again. But this is pretty much the same. And hopefully this is what you have been doing all along. But employers shall not permit suspected or confirmed COVID-19 employees or other persons to report to or remain at the work site or engage in work at a customer or client location until cleared for return to work. If they're teleworking, none of that applies basically, but they have to truly be teleworking. They can't just dip in and out of the office if they're COVID positive or suspected. They have to be 100% working remotely. For contractors and temporary employees, employers shall discuss with subcontractors and companies that provide contract or temporary employees the importance and requirement to exclude from work employees or other persons, such as volunteers, who are suspected or confirmed COVID-19 cases. Subcontractors shall not allow their suspected or confirmed COVID-19 employees to report to or be allowed to remain at work or on a job site until cleared for return to work. And I am interpreting that when they say job site as indoors or outdoors. So that's all pretty much the same as from 2020. We're just reiterating it again. Okay, what's the deal with quarantining? Same as before. You should establish a clear system to receive reports of positive COVID-19 tests by employees, subcontractors, contract employees, and temporary employees present at the place of employment within 2 days prior to symptom onset or positive test if the employee is asymptomatic until 10 days after onset or a positive test. So basically the 10-day window is still in effect, even with the Delta variant. Even though the Delta variant moves more quickly and has a shorter incubation period, the quarantine recommendation is still around the same. 14 days is probably a safer bet, but 10 days is the minimum. So be real clear. If you don't have it in place already, as you head into the fall, I would go ahead and make sure that your employees know exactly who to talk to when they think that they know that they're positive or they suspect that they have been exposed. Okay, and then once you get that information, the notification requirements, you might recall, are pretty comprehensive. So first you have to notify any other employees who may have been exposed within 24 hours of discovering of the positive case. And that's not 24 business hours, that's 24 regular hours. But you also need to keep confidential the identity of the confirmed COVID-19 person. So if that person volunteers themselves, if they say, hey, I'm the one, here's who I've been in contact with, I'll help you contact them, that's fine. But you as the employer cannot be the source of that person's identity. I know in some smaller workplaces or even some larger ones, people will find out on their own, but that's as long as you're not the source, that keeps you covered. You need to notify any other employers whose employees were present at the work site during the same time period. Also, if you're not the building or facility owner yourself, then you need to notify that person. And then that owner will require all employer tenants to notify the owner of the building or facility owner will require all employer tenants to notify the owner of the occurrence of a COVID-19 positive test for any employees or residents in the building. This will allow the owner to take the necessary steps to clean the common areas of the building. In addition, the building or facility owner will notify all employer tenants in the building that one or more cases have been discovered and the floor or work area where the case was located. The identity of the individual will be kept confidential in accordance with the ADA. So if you are leasing space, you'll need to let the building owner know, and they will need to take it upon themselves to clean the common areas and notify the other tenants on that floor. And then the additional rent notification requirements, you need to notify the Virginia Department of Health. And we've put a link to the case reporting portal in the chat. When you've had 2 or more confirmed cases of COVID-19 present at the place of employment within a 14-day period testing positive during that 14-day time period. Employers shall make such a report in a manner specified by VDH, which is laid out on the form, including name, date of birth, contact info for each case within 24 hours of becoming aware of such cases. And again, that's not 24 business hours, that's 24 calendar hours. And then also the Virginia Department of Labor with the discovery of 2 or more cases. I think, I need to clarify this, but I think if you report to the VDH versus using their portal, I think Department of Labor and Industry also is notified, but I'm not quite sure. I need to verify that. Okay, when can an employee who tested positive return to work? This is all pretty much the same as before, but it bears repeating. And it doesn't matter, regardless of vaccination status, that person must immediately remove themselves from the work site, and they must stay home until at least 10 days have passed since symptoms first appeared, and there is no fever for at least 24 hours without the use of medicine, and other symptoms have improved. A person who tested positive for COVID-19 but never developed symptoms of the illness can return to work 10 days after the date of the positive diagnostic test. You might have heard about the antibody test, which is also called serological testing. It has not been determined that persons who test positive for the presence of antibodies by serological testing are immune from infection. So the standard says that these types of test results shall not be used to make decisions about returning employees to work who were previously classified as suspected or confirmed COVID-19 cases. They shall not be used to make decisions concerning employees who were previously classified as suspected or confirmed COVID-19 about grouping, residing in, or being admitted to congregate settings such as schools, dormitories, etc. So essentially they're saying as of now, these tests don't hold any water in terms of determining if someone can return to work or attend events or enter schools. Okay, so a little bit more detail here on sort of what we've already been talking about. If they're suspected, regardless of vaccination status, then you must immediately remove that employee from the work site and either keep them home until they meet the return to work criteria on the previous slide, or they can provide a COVID-19 PCR test, and you need to pay for that. If the test results are negative, the employee may return to work immediately, If the test results are positive, the employer must comply with quarantine and return to work guidelines as previously stated. If the employee refuses to take the test, the employer must continue to keep the employee removed from the workplace. Absent undue hardship, employers must make reasonable accommodations for employees who cannot take the test for religious or disability-related medical reasons. Now, I personally have not come across somebody who said they can't take the test due to disability or religious reasons. I can see that maybe coming up in certain circumstances. I can think of a couple of medical reasons that might prevent the test. Religion, I haven't seen one in that for this particular for testing. But if that comes across your desk, then you need to just again consider whether or not this person refusing to take a test presents an undue hardship to your business. If someone lives with a COVID-19 positive person, caring for them or just simply residing with them in the same household, there can be ongoing exposure there. So the caregiver or household member should ideally begin to self-quarantine while providing care for that person and for a period of time after the person has been released from isolation. The day the person with COVID-19 is released from isolation is considered to be the last day of exposure for the employee. This day is counted as day 0, and thus the next day is the first day of their quarantine period. So this means that the household contacts may need to remain at home longer than the initial person with COVID-19. This is because exposure is considered to be ongoing within the household while the person with COVID-19 is infectious. So that's, if you have somebody who's in that situation, they might have to be out for twice the amount of time as the initial COVID-19 positive person. Now, between now and September 30th, I know it's already the 24th, you can still get tax credits for people who need to be home sick or care for someone who is sick. If you have questions about that or are not set up for that, please let us know and we can get you set up if you're one of our clients. Okay, so here's the big thing that everyone's talking about with the standard. Masks are back, regardless of whether or not you are fully vaccinated or if you're unvaccinated. Employees in areas of substantial or high community transmission, that means pretty much every county in Virginia, and I'm going to show you a map in a second, or otherwise at-risk employees because of a prior transplant or other medical conditions. Everybody has to wear face coverings or surgical masks while indoors, unless their work task requires a respirator or other PPE. Such employees shall wear a face covering or surgical mask that covers the nose and mouth to contain the wearer's respiratory droplets and help protect others and potentially themselves. And again, this is unvaccinated, fully vaccinated in areas of high community transmission, or otherwise at-risk employees. If you're in an area of low to moderate community transmission, this mask mandate does not apply if you're fully vaccinated. Exceptions include when an employee is alone in a room or office, when an employee is eating and drinking, provided that they are 6 feet away from any other person or divided by a barrier, when it is important to see an employee's mouth, such as for the hearing impaired, or when a medical necessity or religious belief prevents mask wearing. For reasons 3 and 4, the standard says that the employer must ensure that the employee wears a face shield if conditions permit. If conditions do not permit any face covering at all, the employee must remain 6 feet away from others unless the employer can demonstrate if it's not feasible. Now that's a little vague to me. I don't know quite how to interpret that. I can, if someone requests an accommodation and that accommodation is to not wear a mask or any type of face covering, and they cannot be 6 feet away from their coworkers, I'm not sure what the next step is. If you can demonstrate it's not feasible, I guess what they're saying is that you won't get fined or enforced, or that Virginia Department of Labor can't enforce any sort of discipline. But I also don't know what that means for your other employees and how that's going to go over in your workplace. So that's kind of an interesting piece to this mask situation. And here's the map. Areas of high transmission in Virginia are in red. So that's the entire state. Unfortunately, there are no exceptions at this point in Virginia. Now the data changes, week to week. So it could be that certain sections of Virginia start to be dip below the high transmission threshold. But right now, this is where we are in the state of Virginia. Okay, I know this is a lot of text here, but cleaning is still a thing. The standard, I think this is all pretty much the same as last year, but basically, if less than 24 hours have passed since the person who is sick or diagnosed with COVID-19 has been in the space, clean and disinfect the space where they have been. If more than 24 hours have passed, you can just clean it and not disinfect, although you may choose to also disinfect. If more than 3 days have passed, then you don't have to clean or disinfect beyond your regular cleaning practices. Now, if you're in a healthcare setting or food and agricultural production or processing, manufacturing workplace settings or food preparation or food service areas, you probably already have specific regulations or practices for cleaning and disinfection. All common spaces, including bathrooms, frequently touched surfaces, and doors shall at a minimum be cleaned at least once during or at the end of the shift. Where multiple shifts are employed, such spaces shall be cleaned no less than once every 12 hours. So if you have shift workers, what they're saying here is that you need to clean every time there's a shift change. If you are a business that does not have shifts, they're looking for things to be clean at least once in a 24-hour period is how I'm interpreting this. All shared tools, equipment, workspaces, and vehicles will be cleaned prior to transfer from one employee to another. This subsection does not apply when the transfer is from one fully vaccinated employee to another fully vaccinated employee. And I'm going to remind everybody that you as an employer have the right to ask if somebody is vaccinated or not. You just can't ask them why they're vaccinated or not. Employers shall ensure that cleaning and disinfecting products are readily available to employees to accomplish the required cleaning and disinfecting. And you shall ensure that you're only using disinfecting chemicals and products indicated in the EPA List N for use against SARS-CoV-19 or non-EPA registered disinfectants that otherwise meet the EPA criteria for use against COVID-19. Hand sanitizing, still a thing also. Employees shall have access to easy and frequent access and permission to use soap and water and hand sanitizer where feasible for the duration of work. So if you have employees who are out and about or out in the field or in vehicles, you need to make sure that they have access to, at the very least, hand sanitizer, if not the ability to wash their hands somewhere. Employees assigned to a workstation where job tasks require frequent interaction inside 6 feet with other persons shall be provided with hand sanitizer where feasible at their workstation. Mobile crews will be provided with hand sanitizer for the duration of work at a work site or client or customer location and shall have transportation immediately available to nearby toilet facilities and hand washing facilities that meet the requirements of OSHA laws, standards, and regulations. Just a quick reminder, hand sanitizers that are required for use to protect against COVID-19 are flammable and use and storage in hot environments can result in a hazard. So keep that in mind if you have folks who are operating in cars, or company vehicles, or outdoors in the heat. Okay, that does have a couple things about shared work vehicles and break rooms. Unvaccinated employees and vaccinated employees in areas of high transmission should avoid riding in the same vehicle if possible. If vehicle sharing is unavoidable and physical distancing within that vehicle is not possible, these employees must wear a mask and the windows should be open. In break rooms and common areas, unvaccinated employees should not be permitted in shared spaces and common areas unless the employer can ensure and enforce adequate social distancing in that space. If unvaccinated employees are allowed in the space, relevant signage should be posted directing unvaccinated employees to maintain social distancing and mask wearing, wash their hands, and clean any shared surfaces that they used. So it's not enough to just put up signs. You need to actually enforce the social distancing. I know that is something that we're all so tired of doing, but that's what the standard has directed us to do. Okay, like I said, there's a lot more on in the ETS about healthcare settings, but I just wanted to point out a few highlights. Prior to the commencement of each work shift, pre-screening or surveying shall be required to verify each covered employee does not have signs or symptoms of COVID-19. Employers shall limit non-employee access to the place of employment or restrict access to only certain workplace areas to reduce the risk of exposure. An employer's compliance with occupancy limits contained in any applicable Virginia executive order or order of public health emergency will constitute compliance with these requirements. And then to the extent feasible, an employer shall ensure that psychological and behavioral support is available to address employee stress at no cost to the employee. Now, I confess, I did not go back to see if that's new or not. I think it is. I don't remember that being in the original ETS. But that is something to note if you are in a healthcare setting, that's you're going to need to provide that at no cost. So hopefully you already have an employee, an EAP or something in place to help your workers if they need support in this area. Now, higher risk workplaces. The ETS specifically lists these industries, but it doesn't necessarily mean that it's limited to these industries. You might want to evaluate or go through and read that section and evaluate if you think you might fall into this category. But manufacturing, meat and poultry processing, high volume retail and grocery, transit, seafood processing, and then correctional facilities, detention centers, jails, and prisons certainly make the list. But again, if you think you might, if you're not on this list, but you think you might qualify, I would go through and read that section of the standard. Okay, So as you might remember from last year, the planning, training, and certification piece replied to people in the, I think, medium to high and very high risk categories. This time around, it's only for employers in healthcare settings or in that higher risk category. You all need to have a written infectious disease preparedness and response plan. Maybe you can dust off the one from 2020 and just update it. The ETS itself lays out exactly what should be included in that plan. And if I do find a template online like they had last year, I will post it on our website. If you're a higher risk workplace, you only need to have a plan in place if you have 11 and more employees, and you can exclude vaccinated individuals from that count. So if you have 20 employees, but 10 of them are vaccinated, then you don't need to do a plan. The training requirements apply to these same exact categories, healthcare and higher risk industries, unless the employees at the higher risk workplace are fully vaccinated. Fully vaccinated employees can receive written training materials. Unvaccinated employees must receive in-person or virtual training. So what they're saying here is that if you have unvaccinated employees and you need to train them based on this requirement, it needs to be in a setting where questions can be asked, not just a passive, here's a PDF to read over. You really need to have more of a traditional training. You can do that virtually. You can do it in person with the proper safety protocols. And then you need to certify that these folks have taken the training, and you must keep those records on file. So there's much more about this, much more detail in the ETS itself. But if you fall into these categories, I would encourage you to go in and look at those details, and then the training, all of this should be done by November 7th. Okay, last but not least, I think this is my last slide. Discrimination. This is the same as before. The ETS is very clear that no person shall discharge or in any way discriminate against an employee who raises a reasonable concern about infection control related to COVID-19 to the employer, the employer's agent, other employees, a government agency, or to the public, such as through print, online, social, or any other media. And that is that means that someone can go out onto Facebook or Instagram and say that XYZ company is not complying with the guidance, and I don't feel safe to work there, etc. Hopefully that won't happen. If it does happen, I would advise you to approach the individual and talk about their concerns, listen to them, and do your best to address them and hopefully mitigate any further complaints. But if you come up with a clear policy and communication structure for concerns ahead of time, you could probably mitigate disgruntled employees going online and disparaging the company or trying to disparage the company. But the point is that you certainly cannot fire them. You should not punish them in any way. You should approach them with a listening ear, and certainly be armed with the facts and all of the things that you have done, and a policy that's in place as we go into the fall under this new amended standard. And special prize, you can identify the child in this picture. I shamelessly put a picture of my own child into this deck today because
I knew that was her.
I know.
And that's Amy's dog.
Actually, no, that's my brother's dog.
Oh, it looks like Amy's dog.
I know. We have dachshunds everywhere. But yeah.
I love that picture.
Yeah, she's walking the dog. Anyway, that is, I think, the last one. Yes.
Hey, I think it would be good to go over the COVID related sick leave and where that is presently and where it was, because a lot of this is affected by that. Especially if you have quarantining or you have people who are still coming down with COVID. That COVID related sick leave, basically it's all over as of September 30th, 2021. So that's literally, in 6 days. As far as I know, there isn't anything in the works to extend that. But having said that, the last time it got extended was on December 27th, and it got extended beginning on January 1st. So just to recap, if you had people who were quarantining or had COVID, you had to give them, it was mandatory to give them up to 80 hours of COVID-related sick leave from the 1st of April of 2020 to December 31st of 2020. From January 1st of 2021 until April of 2021, April 1st of 2021, employers could allow their employees to use that COVID-related sick leave, and they could get those tax credits for that if they had hours left over. So if you had people who, they got 80 hours in April of 2020, come January, they still had, 60 hours, you could allow them to use those hours and receive the wages from the government and the tax credit in the form of a tax credit. As of the 1st of April of 2021, additional hours were added to that bucket. Biden added another 80 hours that employees were able to use. Now, again, it was voluntary, but come September 30th, that is gone, and you will need to revert back to your traditional sick leave policy, whatever that is. If you don't have a sick leave policy, then your employees don't have any safety net if they come down with COVID. So I just thought I would put that out there.
Yeah, no, that's great, Tracy. I should probably throw that slide into every presentation I do until the 30th, but
well,
so,
even after the 30th, because I think a lot of people, they may be aware of it, kind of, sort of, but they need to understand that they're going to revert back to their old sick leave policy, whatever that was.
well, and if the federal directive from OSHA makes it through, that says that they have to provide paid leave for people to go get vaccines.
So I saw that too. So when they say they have to, they're not going to, my understanding is you're not getting a tax break. You just basically have to give that up.
I haven't seen anything about a tax credit unless
Me
that's
either.
who knows if the IRS is involved in this one or not, but
so companies would just be footing the bill for that.
yes, and I don't know, I'm assuming one of the FAQs will be, does that mean that comes from their PTO, but their regularly accrued PTO balance, or is it an additional paid leave?
What happens if it's mandated? What happens if you don't have a sick leave policy?
Right. Yeah.
So I don't know. It's always something.
I mean, I would think if you can swing it, I don't know. If I were an employee and I had a PTO balance of say 100 hours and I needed to be out for COVID, I would just, burn through my hours. But if I needed to get the vaccine, I would think the employer would maybe just give me that 2 hours and not deduct it from my balance. I don't know.
But I think that also said any adverse reactions to the vaccine as well. Wasn't that included in that?
Yeah. So if someone needs a day to recover.
Or more, if you get really sick. So
Yeah.
I don't know. See, to me, that's just left this door wide open. And it's a potential, pitfall for employers.
Yeah, especially large ones. Be interested to hear from the listeners what's happened with how they've been handling this. But for the next 6 days, you can get tax credits. So if you have people and tax credits also apply to people who are getting the vaccine or recovering from the vaccine, or taking people to get the vaccine.
Yes, absolutely.
So if you want to go ahead and push the vaccine with some of your on the fence employees in the next 6 days, you'll get a tax credit for those hours. So now would be a good time to do that if that's where you're headed. All right, should we get to some questions? Do you, Angie or Kevin, want to read some questions? If they're still with us.
Silence.
Yeah, sure.
Hi, sorry, Angie, a surprise.
No. Kevin and I can tag team on these. I'll start with the first one. This came from Catherine. Do you have to notify other employers if the employees are considered a close contact of the case, or regardless of if they were exposed or not? Like if the exposure was on a different floor than the visitors?
I would say yes. You use the elevator, you use a common space like a bathroom. I think you have to let everyone know.
In the whole building?
Yeah.
I agree. Okay, well, Allison asked, are these rules for all employers regardless of size?
So at the Virginia level, yes. I have not seen any sort of threshold in terms of employee count. And somebody, please correct me if I'm wrong, because I don't have the ETS printed out in front of me, but the federal directive to OSHA would apply to employers of only 100 employees or more.
And that's a count, like a head count, not
Head count,
FTEs. It's
right.
like 1, 2, 3, 4, no matter how many hours they work.
And
So
it's doesn't
part-time, full-time, whatever.
Right.
right. And it applies to total employee count, not just at different work sites.
So it's aggregate.
The aggregate, yep.
And I think you just answered this, but Catherine also asked, does ARPA, I know you did, leave officially expire on 9/30, or has it been extended?
As of today, it expires 9/30. But like I said, last time it was the 27th of December. So I'm just going to say as of today.
As of today at 11:47.
Yeah, exactly.
Okay. Marty asks, if someone has been exposed to someone who tested positive, do you consider that's a suspected case, or can they come to work if they aren't showing symptoms?
That's a great question. I think that would be suspected I mean, it depends on the exposure. I mean, do they live with them? Are they been around them a lot? Is it just a quick hello in the hallway? But if
I thought it was longer than 15 minutes.
15 minutes, 6 feet, within 6 feet,
Right.
unmasked, probably, right?
Yeah. Yes. That was my understanding from the last time.
Yeah, but if they aren't showing symptoms, but if they have been truly exposed, if they meet that exposure criteria and they are asymptomatic, they still need to get tested.
Right.
Yeah.
Because you don't know.
Yeah. So if you go back, once we post this presentation, Marty, on our website, there's a slide about suspected cases. Hopefully that will answer your question. If not, email me at questions@dominionpayroll.com and we'll talk about it.
I also think you can't be exposed today and then go get tested tomorrow. It takes, a certain amount of time.
Yeah, I think the original COVID was 5 days and Delta is like 3 days. It's a faster moving variant. So yeah, the cautious side of me would say, Marty, to have that person not come to work,
Yeah,
and get a test on day 3 after exposure, and then hopefully they can get a rapid result test, and then hopefully they're negative, and then we're all good. But if it's just to be on the safe side, I would keep them home.
And then Marty also asked, if we have a vaccination requirement and masking, do we need to do a pre-screening each day, or can people self-monitor for symptoms?
I think I only saw in the pre-screening requirement for healthcare settings. I don't think I saw anything for regular non-healthcare businesses if you're following all the other rules. But definitely self-monitoring and reminding people what the symptoms are. I mean, again, we've been in this pandemic for a year and a half, and people's, they might forget what the symptoms are, even though that seems crazy, but that's how we are.
Okay, Paige asks, in regards to masking, is this state mandate based on the map you showed? Sorry, just want to clarify. We do not have many visitors in our business nor clients, so I want to make sure we're doing the right thing in regards to mask. We have initiated all 55 employees should be back to work October 4th. We currently have not stated that masks are required. We have left that to team members.
So I just want to be clear, it's a mask mandate in workplaces. So we have yet to see what we saw back in 2020, which was in early 2021, which was a mandate for people to wear masks in public. So they're starting with, in my view, workplaces. And so if the workplace is located in a high transmission area, which is based on that map, which is from the VDH website, then it must comply with this masking rule where everybody, regardless of vaccination status, has to wear masks unless they're in their own office or they're in a room by themselves eating and drinking, although still 6 feet apart, or they have some sort of disability, or, you know, there's some medical reason why someone needs to see their face. So so to answer your question, Paige, when your folks come back on the 4th, which is a Monday, on Friday, October 8th, they need to wear masks if they're in the office.
Do exempt employees count towards the 11?
Yes. I didn't see any distinction between exempt or non-exempt.
Okay. Okay, Darlene asks, time off mandated if under 500 employees, correct?
If you're
Don't know about that.
is she referring to time off to get the vaccine?
I think so. The one that's coming through the Fed.
Oh,
I didn't think there was a threshold stated.
No, I mean, the 500 employees originally was the threshold for FFCRA leave, right, Tracy?
Right. Yes, that's correct.
It was employers with 500 or fewer employees had to offer that paid sick leave, or could offer it in 2021.
Mhm,
But
mhm.
Darlene, I haven't seen the opposite direction. I haven't seen a cap on this new OSHA directive for 100 employees or more. So again, we don't know a lot about the details about that one. So it could be that there's a cap, but I just don't know yet.
Okay, and then Marty asks, can you gather vaccinated employees outside without masks?
Man, these are good questions today. I'm pretty sure you can. Now we do know that vaccinated people can still carry the virus and transmit that to unvaccinated people. So, but I'd have to go back and really read the standard again. I don't think it did say work sites, which to me was outdoor work sites. But if you're talking about some sort of like social gathering, I don't know that it pertains to that. But then again, if it's a work sponsored social gathering, maybe it does. That's a really good question.
Yeah, I don't know.
I mean,
I haven't seen anything on that yet. I think they're just trying to formulate how it's going to look.
Uh-huh.
Right.
Allison said 15 minutes within 6 feet, regardless of mask, is what their physician said.
Okay. Thank you.
So even exposed if they had a mask on or not.
Okay.
Okay.
Thanks, Allison. Okay, and the last one from Mark. Can you repeat the answer about 50? Oh, we just did 15-minute exposure.
Yeah.
I don't read these ahead of time. I read them as we go, and sometimes it's like, oh, we just did that. So Mark, if we didn't, yeah.
That makes it more fun.
It does. Okay, and then one more came in. Is there a PDF or easy cheat sheet available with new rules, dates of enforcement? Yes, that's going to be on our website later today with the PDF that Lesley just showed, and the recording will be out there later.
Well, and Michelle, I know there's state level and federal level things going on. So when we get more guidance on the federal level in terms of the deadline for compliance, we'll put together something that's a bit more concise, that has the dates for compliance for both state and federal, and if you need to do training, et cetera, because I know it's a lot to juggle. If I were you, if you're in Virginia, if I ran your HR department, or if I ran your business, I would go ahead and start to lay out an overview of this policy for your team. Go ahead and get them, just go ahead and start socializing it among the team. If some people want to work from home because they don't want to wear a mask in the office, let's work that out now. And people are not going to like this. I don't like it. But here we are, and I don't know much about the enforceability of this new standard, but I do know that people can call and complain to the Department of Labor at the state level if they think that you're not violating or think that you're not complying. I don't know what I've heard $14,000 batted around as the potential fine, which is, a good chunk of change. So I would go ahead and start getting your employees in the know about this, about what's coming. You get a couple weeks here to have them do this. And of course, you know, the idea, and we all know that Northam is a pediatric oncologist. He's pro-vaccine. So if people are on the fence about the vaccine and they're thinking about getting it because they don't want to have to wear a mask in the office, this sort of sets us back a little bit, because even if you get vaccinated, you still have to wear a mask in the office. So it's just a tricky time to navigate, but we are definitely monitoring everything and trying to make sense of it all for you. And so if you have any additional questions, please let us know. We will probably be back, if not next week, definitely the following week with more information. And then we will post this on our webpage, our COVID-19 page at dominionpayroll.com by close of business today.
And that is all the questions we have in the queue.
All right. Well, thank you so much, everybody. Thank you, Angie, Kevin, and Tracy, for joining me today.
Thanks for
Absolutely.
putting it together.
Nice to have the gang back together, and everybody have a lovely, lovely weekend. Enjoy this weather.
All right. Bye,
Bye,
Leslie.
guys.
Bye.
Bye, Angie.
Bye.